Hey everybody, let's make sure you can hear me. Okay. All right, so I'm gonna be on here really briefly today. I'm running late today. Um, I got caught up dealing with producer of supplements this morning, but today we're going to be talking about women's sexual health. And if you are excited about this topic, please post. And if this is your first time joining, please subscribe. Please hit the like button, hit the thumbs up. Because that's what keeps me being able to get posted here. I will be posting this on YouTube, and you'll be able to see that this weekend if you missed it live. And I'm excited to be here today. I hope you are too. So this is a complex topic, and it cannot be covered in even an hour. But we have a lot of folks that are having problems in this area during the pandemic. There's a lot of people that are suffering with the isolation of, being unable to socialize and all that. And initially during the pandemic, there were a lot of people were having more sex, and then we started to see trends in the domestic violence. And I think that's a manifestation of things that were already there, and the dysfunction just got heightened, I would say. But we already had, before the pandemic started, we had problems with people, especially millennials, who are trying to have babies, were having problems getting pregnant. There's record levels of infertility. My theory is that that's because of all the toxins that we have that we're exposed to, air, food, and water. It's also because we have toxic environment for people in their interpersonal relationships. People are being asked to work more and more and spend less time with their families, spend less time connecting with others. And this affects interpersonal relationships. And so you have a breakdown in society. So we've got all that going on. And I'm finding that in talking to my friends that people, I think it amplifies the dysfunction in people's relationships when they're locked in together. So people are making choices that they probably never thought they'd be making at this point, because they're seeing too that life is limited, and we're all going to die someday, but I think it accelerates your thoughts about what you're going to do with your life when you have this pandemic going on. So people are giving a lot of thought to that. All that affects women's sexuality, because women are very social beings, and the orgasm for women starts in the mind, and women are very different from men in that way. So what we know too is if you go back and look at the first post from September, I talked about orgasmic meditation. And if you go on that page, and start looking and doing research, looking at that, you'll see, that there's been a lot of research showing that the orgasm for women starts in the brain before it starts anywhere else. And that's been documented on functional MRI. So for women, as for men, there are a lot of complex autonomic nervous system and hormonal systems that are involved in sexual function. So I think a lot of women probably know about the basic hormones that they talk to us about in school 20, when I was in high school, which was many, many years ago. That was back in the 80s. And they talked about estrogen and progesterone and how those hormones cycle to help with the egg being released from the ovary. And there's a whole cascade of hormonal ups and downs that happen prior to the egg being released, and then on the release of the egg, and then after the egg's released, and then after the egg kind of shrivels up and goes away. During the whole cycle, there are hormonal fluctuations, and women have super complex hormonal fluctuations. So other hormones that are involved in these hormonal fluctuations include GABA, which is a neurotransmitter actually, includes dopamine, which is also another neurotransmitter, includes oxytocin, which is another neurotransmitter. And there are some others, but those are some of the main ones. And so what that means is that our body's metabolic systems and our bodies have to be very healthy and working properly in order for the sexual response to work. The nervous system is affected by high blood sugars, and there's an epidemic of that going on right now, and many people don't know that they're experiencing fluctuations in their blood sugars. But many of us are overweight, and this is a sign that we're having problems with our blood sugar regulation. Also, thyroid function affects all the hormonal systems, and so it's imperative that we need to check on those systems if we're having problems to make sure that the thyroid is working properly. And that's also manifested by overweight and obesity. And there's also an epidemic of that going on, and people don't know that they have that going on because their doctors are only checking a thyroid stimulating hormone, which doesn't really tell the whole story. So, with women's sexuality, I would say that if we are having problems in that area, that we should first get checked out by the primary care doctor. If the primary care doctor doesn't have answers, and if you're picking up some cues from some of the things that I've said, you can go online and do some research. You can talk to your doctor about doing more testing than what they normally do. You can also consult a holistic doctor like myself, and we definitely do a more in-depth view of what's going on with the hormones. I like to use a couple of different functional medicine companies for hormones, and there are options that are affordable. You can also be proactive and improve your nutrition and try to clean up your exposure to toxins. You can also learn how to meditate, learn breath work. These also help in clearing toxins and clearing toxic relationships. And look at your relationships and see, is your partner willing to work with you? Is your partner willing to try different things? Go on the website and look into orgasmic meditation. There are some other methods that can be looked into, but there has to be a willingness, and many times partners may get stuck in a rut and they may not be willing to consider other options. And many people don't realize, because many women have never experienced an orgasm. That's actually pretty common. So because I would say there's a lack of education about the sexual organs, and many women don't even know their own anatomy, and that many women do not reach an orgasm with just the penetration, and they need other stimulation. So I don't want to get more graphic than that, but because I'll get banned on these channels, but I would like for this to stimulate conversation and to stimulate you to look for help. And you can reach me on Instagram at Treat Yourself to Health. You can reach me on YouTube at Treat Yourself to Health. And my website is treatyourselftohealth.com. Facebook is Treat Yourself to Health. And my phone number is 703-454-9326. And please hit the like button, the thumbs up. Please subscribe. And I look forward to seeing you next week. Thank you. Have a great day.